So with that being said, IVF is one of the most common treatments we do. My colleagues have talked about the artificial insemination cycles, the use of surrogacy, the use of egg donation, freezing of our eggs and preserving the fertility. All of the things, every single option of fertility treatment that is available in the world, we do provide here at SCRC. We have a fantastic team of people. We now have in-house acupuncturists. We have an in-house nutritionist. They are amazing. Our team is all here 7 days a week and able to help anyone who needs help with anything. We do want to go ahead and let everyone know that we are available on lots of different social media channels. And all of us have our own social media channels on the Instagram page, including the clinic as well. And at this point, what I would love to do is to open up and see if there are any questions. We are happy to answer any of them.
All right, so I'm going to go ahead and start off reading some of the questions. For women with low AMH level over the past 2 years who just turned 38, would you still recommend taking 3 months worth of supplements to improve egg quality before harvesting, or would you advise immediately harvesting or something else? Dr. Danzer, do you want to answer this question?
Yeah, it's a debate, and there's different philosophies. You know, certainly nutritionists and acupuncturists tend to want to prepare the ovary better for harvesting of eggs. There's some scientific data that says that it really takes maybe 3 months for the primordial follicle to become recruited for an IVF cycle. But again, you have to balance that with where you are and what time your schedule is. Certainly, there may be some advantage to that. I don't know that we know how to quantitate that very well. And again, a lot of women say, gee, you know, take 3 months to do all this, and how much is it going to benefit me? I think, as we talked about, good nutrition, moderate exercise, good night's sleep, some treats once a day. Those are things that are really prepare you for an egg-free cycle or an IVF cycle.
Dr. Ghadir, next question for you. Do you recommend?
I'm just sorry. I just want to add one thing to that. First of all, I love how Dr. Danzer said treats, because he loves a good treat every day, and so do I. But I did want to say that I personally do not think that waiting 3 months and taking supplements is going to have an improvement in the cycle. You have a specific number of eggs that you were born with, and taking supplements for 3 months may be great for your body and getting you prepared, but nothing is going to create more eggs. And during those next 3 months, your AMH will continue to go down. And thank you, Dr. Akopian. I see the next question was if adding 75 milligrams a day of DHEA for anyone who has low AMH is recommended. I do recommend that to all of my patients. And I do think that there is some benefit of having the DHEA, but again, I think that you have to kind of just look and weigh your options. I think waiting 3 months for the benefit of that, I would be taking it, because you never know. What if you did that cycle just that following month, but you do have to repeat it in 3 months? And I think by then you would have had the maximum benefit, but I don't recommend for my patients to wait that period.
For someone undergoing an egg freezing cycle who needs to take pain medicines regularly, which medication is safest to use and the maximum dose you would prefer to be used? High dose ibuprofen, Aleve, Tylenol, something else? Dr. Danzer, you want to answer this question?
Yeah, which were the, I don't read, maybe you should answer that. I don't see the listing of the medication.
Okay. So I think this is really dependent on who you're working with, and it needs to be individualized. One is, why are you undergoing or taking such high doses of pain medications? And this really does require a consultation with a physician you're specifically going to work with to discuss the pain medication, why are you on it, why such high doses, and how it may or may not affect the treatment. Is it safe to use organic?
I just want to add, can everyone please just put your questions in the Q&A versus the chat? I think it's just going to be much better concise there. For the ones that are already in the chat, we'll make sure to answer them. But just please, if anyone's adding questions, please go to the Q&A. Thank you.
Is it safe to use organic CBD products such as ingested oils for pain, inflammation, or anxiety during egg freezing? Dr. Ghadir, you want to answer that question?
So from all of the data that we have seen out there, the use of marijuana products is not necessarily beneficial and can have detrimental effects on egg and sperm quality. So I would recommend for the patient not to.
Next question is, will the recording be available? Yes, the recording is going to be available as far as I know. Is that correct, Dr. Ghadir?
I think that it's going to be put on our YouTube channel. However, the slides are not going to be emailed to everyone. You're welcome to look at it, but it will be going onto the YouTube channel.
Next question is, I have had 2 early miscarriages when conceived natural in the past year. I am 37 years old and spouse has low morphology motility. Would IVF be the best option? Would my outcomes possible of miscarriage be the same with IVF? So I think when someone has had history of 2 prior miscarriages, it's very appropriate to do some testing to see if there is a cause other than genetics for that miscarriage. If the cause is really related to age-related decline in the quality of the eggs and therefore genetics, then IVF can decrease chances of miscarriage by selecting for a genetically normal or euploid embryo for transfer to increase success rates there. But it really does require other testing to make sure that there's no other cause for those miscarriages to have taken place. Next question, why do you always freeze the embryo even if you want to implant it immediately? Are there any impacts to freezing? Dr. Danzer, do you want to answer that?
Yeah, I think almost all embryos, not all, but there's been a shift to freezing embryos because all the stimulation that occurs to the uterus during the IVF process, the estrogen, instead of being 200 or 300 when a woman normally ovulates, it's 2,000 or 3,000. We know that implantation rates seem to be higher from frozen embryos. So you get the eggs, you fertilize them, you make the embryo, and then you freeze the embryo, let the body recover. The next cycle is when you would transfer the embryo. Pregnancy rates are higher.
Is there a ballpark cost for embryo freezing, Dr. Ghadir?
We have financial counselors that can go over the cost of everything. I don't even know where to start. I want to say it's something around $15,000, but I'm not sure. Everything like that depends. If you are very young and very healthy and you're going to need very little medication, then your cost is going to be by far lower. If you are older and need to get some of the most advanced medications available, the cost of your medications are going to go up. If you wanted to use something available to you, like a tool like the EmbryoScope that's been proven to give higher success rates, the cost is going to go up. What I do want to just bring to everyone's attention is that sadly, some of the clinics that have by far more economical cycles and packages also have some of the lowest success rates in our industry. And I would be very, very careful picking a clinic based on the cost only.
Dr. Danzer, what are the cons of doing a transabdominal egg retrieval if somebody wants to preserve their hymen?
Yeah, we do a fair number of transabdominal retrievals. It's relatively easy to place the needle through the skin and into the ovary. I think you have to have a good egg supply to have a good response with that, but it certainly is an option if the woman chooses that.
Next question is, I'm under 32 and have not been consistently trying to conceive for 12 months, but I have had 2 blighted ovums in the past 5 years. Should I consider consultation at this point or continue trying? I actually recommend consultation to look at your history and also do some ovarian reserve testing and at the minimum check the sperm to make sure if there's anything that we can find as a cause for the difficulty or having the history of 2 blighted ovums. I've read that there was no vaccine testing on pregnant women or women trying to become pregnant. Would you recommend fertility treatment after the COVID vaccine? How would the vaccine affect fertility? Dr. Ghadir, you want to answer this?
So this is like the $1 million question right now, the question that I get asked on my social media channel and friends texting me all the time. We don't have the answers. Unfortunately, we do not have the answers. The FDA has approved under emergency circumstances vaccinations that have come out. So you have to use your judgment and what you feel most comfortable with. There is no data out there about anything, and no studies have been done with giving the vaccine to pregnant women or women that just became pregnant at all. So you have to kind of deduce things and see which is the safest. Are you okay with the risk of potentially getting COVID while pregnant? For me in particular, I would say that is a scarier thought and a bigger risk than doing the vaccine that seems and appears to be safe right now. But I think this is a very individual question, and unfortunately, the medical data is not out there at all to answer this question well right now.
Dr. Ghadir, the next question is for you. Apart from PGS testing, what else can a woman do to prepare for FET to be successful? Does the current pandemic affect women negatively?
So I have to say, I think the current pandemic has not affected many women negatively because a lot of people who are concerned about their fertility are taking great care of themselves. People are eating well, people are exercising, people are trying to do everything they can. For many people, this has become a much more stressful period. For many people, it's become a time that they've been able to take control of their life and work from home and do things that are important for them. I do think that the PGS testing is one of the most important things to increase the success of frozen embryo transfers. However, there are a lot of other things. I think the body mass index, or BMI, or the weight should be as normal or as close to normal as possible. I think having a healthy lifestyle that involves eating healthy, being mentally healthy, sleeping well, and completely taking good control and feeling good about yourself are important things that help people have great implantation. So as equally important as the science behind the genetic testing, there are other things I think in people's lifestyle and staying positive and having good energy that I think are very, very important, and things that I really like to emphasize with my patients, because I don't like to treat this only as a scientific way and as that only, but I like to treat people holistically and making sure that they are in touch with themselves and doing positive things for themselves during the cycle, because I think it makes a huge difference.
What is the cost of IVF at SCRC? What payment options do you guys have? So we alluded to this. The best would be for you to speak to our financial counselors, and we do have a third-party loan group and agency that somebody needs assistance from that perspective. But the best is going to be to really speak with our financial counselors. As physicians, we'll probably give you all the wrong answers. Next question, what ranges for AFC, FSH, estrogen, AMH do you like to see for successful IVF? Dr. Danzer, would you like to answer this question?
So the question was about AMH.
What are the best ranges for AFC, the antral follicle
all the
count?
baseline tests.
Right. Yeah, so an AMH of 2 or more is a good number, reflecting, again, a good reserve. A basal follicle count of 15 to 20, and that's our goal, whether we're going to freeze, we're going to make embryos or freeze eggs. The retrieval of 15 to 20 eggs is kind of we want to say the sweet spot. You don't want to be under or overstimulated, but that's the goal, 15 to 20 eggs for a stimulation cycle for IVF.
Dr. Ghadir, should I try naturally at 40 when I have frozen eggs at 38?
Love that question, but I'm going to say one more thing about the previous question. There are very few people that come to our office who have amazing antral follicle counts, amazing FSH levels. We are a fertility clinic that are helping people that have had struggles. So we have had people with AMH levels as close to like 0.17 and low antral follicles make 2 eggs and leave here pregnant. So I don't want to discourage anyone that has a low reserve, because those are the kind of patients that we thrive to help and leave here successful. So wanted to just add that. I would say that if you have frozen eggs at 38, I would leave them for a little bit, and I would definitely give a try to using and seeing what happens at 40. Your frozen eggs aren't going to go away, and they're going to still be there. However, I also wouldn't continue to try for 5 years until you hit significant other issues of being pregnant as an older age. So I would think it's smartest to make an overall plan with your physician about how many months to try on your own. And if it's not working, what's the next step? And if not working, then when do I use my eggs?
We've had 2 semen analyses with low motility and other poor results. What is your recommendation of what are our options? Male is 42, female is 39. Female has 8-year-old daughter from previous marriage. Female has no reproductive problems. We've been trying since April of 2019. My best recommendation is actually to move on with treatment, but likely with IVF. to overcome the low motility and other poor results that the semen analysis has shown, and also have the ability to genetically test the embryos, and that would be more geared for the age of the female being at 39, to be able to obtain embryos that are genetically healthy and increase the chance of pregnancy. And if you've been trying to conceive naturally since April of 2019, it definitely is time for treatment of some sort. So I would really highly encourage you to make an appointment and see one of the physicians here at SCRC to help you through your journey. I'm 29, my husband is 36. I want to wait another year before getting pregnant and would like to have 2 kids. Would you recommend freezing embryos now? Maybe not for our first child, but for the second child. I might be around 34, 35, but by that time. Dr. Danzer, you want to answer this question?
Yes, we have many couples that come to us that, again, there's a point where they're in the middle of law school, or they're in the middle of a career that needs a few more years before they're going to start their family. And they do IVF for create an embryo. Again, once you have a genetically balanced embryo, there's that 70-75% chance of success. So that could be for baby number 2 or 3. Could be for family balancing. They had a boy and they want a girl for the next time. So that's very a viable alternative. But we see some women at 29 that have a diminished egg reserve. And I think we would encourage everyone that's in the webinar today, if you're concerned about fertility, at least to come in and have an evaluation and see if they're what the egg reserve is, what the sperm count is, and get a plan to prepare for the number of kids you want to have for your family. I think that's just a good thing to do for everyone on the webinar today.
Dr. Ghadir, what is your recommendation for a 42-year-old female considering egg freezing for IVF in 3 to 5 years?
I would recommend that you freeze your eggs as soon as possible. Unfortunately, we see that after the age of 35, there's a significant decline in the quality of the eggs. So just getting eggs out doesn't necessarily guarantee that you're going to be successfully using them. So I would recommend any 42-year-old who's interested in freezing their eggs to freeze as many eggs as possible, maybe even more than one cycle, and make sure that you have many options available to yourself when you come back to use them in 3 to 5 years.
Do I need to stop my supplements once I start with egg freezing procedure, like glutathione shots, ubiquinol, pregnenolone, and melatonin? Dr. Ghadir, what are your recommendations?
I think that some of the things you can take, I have no issue with someone taking melatonin. Ubiquinol is something that we recommend for everyone for improvement of egg quality. Pregnenolone, that starts to get into a mixture of affecting progesterone as precursors, and I'm not necessarily sure that would be a smart one to take. And I'm really not sure about glutathione shots. So I would say if it's anything that's incredibly necessary or completely proven to be healthy, then I would continue. But if it's something that's questionable and we're not sure on, why risk the chance of it having a harmful effect?
Dr. Danzer, someone is indicating that they've had a series of biochemical pregnancies, 3 to 4 in the past 7 cycles, when they've been trying to achieve naturally. Is ART going to help? If so, is it best to do IUI or IVF?
I think chemical pregnancies or miscarriages are probably 90% of the time are genetic in origin. Certainly, you want to evaluate the anatomy to make sure there isn't septum or other issues with the uterus, but most miscarriages are from early or late, are from genetic imbalance. And IUI is, again, not going to improve that. It's only with IVF where you can genetically test the embryo that clearly gives you the best chance of getting pregnant and the shortest time to pregnancy. There's many studies that have shown that.
I would also add to that, you also want to make sure that the uterus is being evaluated and there is no things that inside the uterus like polyps, fibroids, or septum that could be giving that result. So I do think that's probably time to do a bit of evaluation and see if there's any other causes for that. Do you see any issues with a natural conception for a 31-year-old female with one ovary? The other one was removed because of a teratoma. So I don't see any issues with having a natural conception with one ovary, but I do want to recommend for you to do an ovarian reserve testing. The reason for that is if you only have one ovary and you have a desire for 5 children, then maybe there's a discussion in being able to have planning for the future. So I do recommend at least to do an ovarian reserve testing and see in the one ovary that you have what the follicle count looks like and what the potential for future is, and are those potentials in line with your family planning goals? By what percentage does the success rate increase for FET once an ERA has been conducted? Dr. Ghadir, you want to answer this question?
Yeah, I don't know what the exact percentage that the study showed. Do you know that, Dr. Akopians?
In terms of the ERA, so it depends on what the ERA is showing regarding the success and what's being used for. So it's very dependent on why an ERA was completed and what the results showed, because there's different results, different percentages of success that are out there, depending on what was the reason for even doing the ERA. And I think no difference is seen if you're just doing ERA before the first transfer. Some differences may have been seen if there is somebody with elevated BMI and they metabolize progesterone a little different than somebody who has normal weight. So it really depends on what the intricacies of that are.
So I just wanted to kind of explain for patients what an ERA is. An ERA is an endometrial receptivity assay mock cycle. It's identical to the frozen embryo transfer, and it's generally done the month before the frozen embryo transfer. It starts off with birth control to stop the cycle, and then it continues with estrogen. And once the lining of the uterus is nice and thick, we begin to put the progesterone in, kind of fooling the body into thinking that ovulation has occurred. And 5 days later, we put the embryo back. For some people, that final portion of progesterone can be altered a little bit. And it's not 5 days, it's 6 days, or it's not 5 days, it's 4 days. Instead of putting the embryo back at the end of the ERA cycle, we do a tiny little biopsy, and that biopsy goes out to a genetic testing company, and it's called iGenomics. iGenomics gives us a result that says the biopsy was done and the lining was completely receptive, meaning it was done perfectly, and the next month you're going to copy it exactly the same, or it's going to tell us if it was a little what we call post-receptive or pre-receptive, when we have to alter the amount of progesterone. I'm not sure if there's a percentage that it tells you what the increase is, but we do see here, especially in the beginning of ERA cycles, that a lot of people that were failing a beautiful embryo going back, it was because they needed a slight adjustment in their progesterone. So doing that and altering and giving the exact recommended progesterone levels has allowed us to have some significantly higher pregnancy rates that we're very proud of.
I do want to also add that it doesn't guarantee a pregnancy. So the reasoning for wanting to do an ERA shouldn't be that if it's done and if adjustment is made, it actually does guarantee pregnancy. It does not. It's just a piece of evaluation to see if there's something we can do differently to optimize the chances. Dr. Danzer, is high TSH and low sperm count related? What's the best fix?
What was the first part of that?
High TSH and low sperm count in men affected.
Right, yeah. Well, high TSH is a reflection of the thyroid gland is not working good. So you have a more stimulated hormone to kind of force the thyroid gland to put out its thyroid hormone. When we see that in women, we know that miscarriage rates are a little bit higher for low thyroid and other problems during the pregnancy. I don't know if that correlation has been very high for men in low sperm counts, but certainly if you have a high TSH level, whether you're a man or a woman, I think there's good evidence to suggest that having that corrected by adding some additional thyroid hormone is better for your health.
Thank you, Dr. Danzer. For those considering egg freezing, what is the impact of oral contraceptives on accuracy of initial fertility scan? So it depends, and it depends on how long you've been on the birth control. If somebody has been on birth control continuously for 20 years, then that may very likely suppress the follicles, as that's what the birth control does, and may give you lower than expected number. So for patients who've been on birth control for a very long time, my recommendation always is to take 1 month off, give your body a break, have the ovaries wake up, and then do the testing at that point. What's your recommendation, Dr. Ghadir?
Sorry, I was reading the next question, so I just wanted to double check it. I think that being off the birth control pill for about a month, at least for someone who's been on it for a long period of time, and I mean like 5-10 years, is smart. It lets the own hormone levels kind of just bounce back up. I'm not sure if 3 months for me is necessary. Again, I think usually within a month of being off of it, people's bodies come back to normal.
Do you recommend freezing eggs and embryos if a couple splits up? What would be better for the female to have that option? So when I counsel my patients, I always say, you know, embryo freezing is great because it has the advantages of us being able to genetically test the embryo and know if you have a genetically healthy embryo, then success rates could be 60-70% per embryo. The drawback of doing embryo freezing is the couple splits, unless both of them consent to use at the later time, then no one can actually use that embryo legally. So if someone has the ability to do 2 cycles, then yes, the best option for planning would be to do 1 egg freezing and the alternative being also embryo, so that you have both options available. Next question. Is it important to be gluten-free, dairy-free, and eat organic fruits and vegetables before IVF procedure? Dr. Danzer?
Yeah, I think, some people, feel better if they're gluten-free, if they have that particular condition. I think it has to be individualized, what you need to do to prepare yourself for any sort of a IVF or treatment cycle. You should do those things. Exercise, good nutrition, low stress, stress management, those have all been shown to be helpful. Acupuncture is something that many women will elect to do for a month or 2 before an IVF cycle or any fertility treatment. I think anything that you could do to, as Dr. Ghadir spoke about, to get your mind and your body in the very best place it can help you go through the cycle with less stress and have a better outcome. That's just common sense.
If my cycle is irregular due to hormonal imbalance, will you try to normalize it for the chance of natural pregnancy before going for IVF? So it depends on what the cause of your imbalance is. If the imbalance is due to a condition called PCOS, then that's really a treatment to make you ovulate, and then the natural conception can follow after that. If the imbalance is due to low ovarian reserve, then it's a different discussion. So it really depends on what the imbalance in the hormones are and what the actual diagnosis is. I'm sorry if I missed this. After egg embryo freezing, is it an IUI that implants them later? No, after an embryo freezing, it's a frozen embryo transfer that we take the embryos, we thaw them, and then we put them in the uterus for pregnancy. IUI is intrauterine insemination, and that is for purpose of taking the sperm and depositing the sperm in the uterus for a pregnancy to take place. I have a good number of AMH, but my FSH and progesterone is elevated. Should I wait to fix that before I proceed, especially if I'm unbelievably stressed in the past 3 months? Dr. Ghadir?
So I think definitely trying to fix your stressful life situation before doing a procedure is an important thing to do. Again, I'm not sure the age of this person, but if your age is higher and you have a good AMH, there could still be a lot of eggs, but they're not of the best quality. Checking the FSH and the progesterone really depend on when you do them during the month. If a progesterone is elevated, all it's telling us is that you've ovulated. If the FSH gets elevated, it could be close to ovulation. But if done in the beginning of the month, then is telling us that you have actually a lower egg reserve. So I think the best predictor of how you're going to do with eggs is AMH, and an FSH and progesterone that are elevated in a random time during the month is not very effective or helpful. With that being said, I think that I would try to get yourself into a perfect and better place, at least better place mentally before proceeding, and try to proceed as soon as you can. And the best time to freeze an egg is when your AMH is really good, not when it starts to decline.
What are the risks associated with egg extraction in terms of future natural pregnancy? So I think this is highlighting a question regarding, we talk about we're born with maximum numbers of eggs. If I take some of them out to do egg freezing, am I going to affect my natural conception? And the answer is no. The reason for that is that every month we select the set of those follicles. Remember what Dr. Ghadir showed and Dr. Danzer showed, that ovary is showing all the little follicles. Imagine like ovary as a chocolate chip cookie, right? Those chocolate chip parts being the follicles, that each one of them has a microscopic egg in there. Every month you select the set, and the set that you select depends on your ovarian reserve. So let's say this month someone's ovarian reserve is around 10 follicles during that month. One gets large, releases the egg, the other 9 dies away that month. Next month, the female body goes back, you recruit another set. One gets large, releases, the rest are wasted. And so when somebody that does egg freezing or they do IVF, what we do is we work with the ones that are going to be wasted that month. So we're not touching your ovarian reserve. We're not affecting your natural conception rates. All we're doing is working with the eggs that were going to be wasted and trying to extract them out of your body and either freeze them as eggs or create embryos with them. Yes, those are incredible levels. I'm not sure which is this referring to. Is it worth to do IVF if I don't have 15 to 20? So I think Dr. Ghadir alluded to this, and you don't have to have 15 or 20 eggs to be able to have a successful IVF. We've definitely, all of us have had patients with way less, and we've been able to achieve successful pregnancies. How long should a woman take supplements or become more healthy before egg freezing? Egg retrieval. So we also have alluded to that. Dr. Ghadir or Dr. Danzer, do you want to add anything more to this question?
Yeah, I think it's individualized. What an individual has to do to get in the very best place. We talk about low stress, and what do you do for stress management? As meditation, you need to really look at your life and say what it is. How can I manage my stress? Because it is a stressful process. It's a project to get yourself through a fertility cycle. Good nutrition, and again, that's individualized. We have a in-house nutritionist now to meet with our patients to really develop a dietary plan if that would be helpful for them. Again, exercise is important. I think moderate exercise is very good. We try not to encourage long distance running. Anything that increases pulse rates above 130, really strenuous exercise probably is not helpful to get ready for IVF. But getting your weight to the very best place it can be, and that's different for different women. And it may take 1 or 2 months for some, it may take 4 months for another to get their BMI to a better place. But everything is helpful. But again, I think it has to be individualized. And I think when the patients come in and get a plan to move forward, the diet, nutrition, the stress reduction are part of that plan.
All right, I'm going to start going through these questions a little bit faster so we're respectful of time for everybody. 31-year-old female, 35-year-old male who had TTC for a year. Husband has low sperm count, motility. Female has 1 ovary. Next step, please see a physician and be able to move forward with the treatment. For a year, you guys have been trying. I think it's time to do something. Medication with intrauterine insemination or IVF would be a good place to have a discussion with your doctor, but also ovarian reserve testing would be important as well, given the history of 1 ovary. What are your thoughts on minimum stimulation methods, which some suggest can minimize medicine harm effects on the body? Dr. Ghadir, you want to answer that question?
Yeah, first of all, I'm not sure of any data out there that says any of these medications harm the body. So all of the data out there for IVF medications has been proven and shown in research not to have any long-term harmful effects on the female body. We're all aware at SCRC that there are studies that have shown that lower doses of medication can be more helpful and more promising and have a better outcome than extremely high doses of medicines like some clinics give. And that those researchers have been studied and we implement those. Giving an extremely low minimum stimulation to someone, which will allow them to make a very few number of eggs, I think can be harmful as well. So I think this is a discussion that needs to be done between you and also your physician so that you can understand what the benefits of something like that would be for you.
I'm 38. I've had 2 miscarriages, one in July and one 2 weeks ago. Both times the sac kept growing, but the actual baby didn't grow. Will IVF help the chances of a successful pregnancy in this case? First, I'm sorry for your experience. I know it is very hard to go through a miscarriage. So I would say hang in there, but in terms of what IVF can offer, I think it's time to do a little bit of workup to see what were the causes of miscarriage. If it's really found to be that it's genetics of the pregnancy that resulted in a miscarriage, then IVF can potentially give the opportunity to genetically test the embryos. And by transferring the genetically healthy embryo in the uterus, you decrease chance to pregnancy and you decrease chance of miscarriage. So I think that's where IVF can be very helpful. How long is process to use frozen embryo to get pregnant? Dr. Danzer, what's an FET timeline?
Yeah, just on the previous question was that miscarriage rates are 15 to 20% for every woman for every pregnancy. That's as good as Mother Nature can do in reassembling these thousands of genetic pieces. When you have a genetically normal, balanced embryo with IVF, the miscarriage rate is about 6 or 7%. So it's 15% versus 6 or 7%. If a woman is 40, the miscarriage rate is close to 20%, 25%, whereas an IVF tested embryo at 40 is still at 6 or 7%. So I think that's the question is once you test an embryo genetically, it markedly decreases your chance of having a miscarriage.
How long is the timeline for an embryo transfer cycle? Dr. Ghadir, Dr. Danzer?
Yeah, it's usually about 4 weeks. Again, we start out with birth control pills to thin the lining of the uterus, get it to a very thin state. And then we use natural estrogen to build that lining for about 10 or 12 days. Once the lining looks receptive, then we start progesterone. The embryos are usually frozen on day 5. So after 5 days of progesterone, that is when the transfer is done. So 2 weeks of pills, 2 weeks to build the lining and transfer the embryo.
Dr. Ghadir, if a patient preparing for an egg freezing just discovered their TSH level is 4, how much time would you want them to take to treat with Synthroid before proceeding with egg freezing with 50 micrograms of Synthroid normalize the TSH quickly enough to proceed?
So first of all, a TSH of 4 on every single lab is considered to be normal. The ideal situation for if you're trying to actually be pregnant and conceive is to have your TSH between 2 to 2.5. For the process of freezing eggs and already on 50 micrograms, meaning like in the next 2 to 3 weeks, there's a very good chance the TSH will be normal. I wouldn't delay this process at all. If it was someone that was trying to actually make an embryo and then put the embryo back, I would make sure that we are in the 2 to 2.5 zone before the embryo transfer. But for the process of freezing the eggs, I would be able to move forward with this patient and tell them to continue their Synthroid.
Dr. Danzer, is it better to get weight and BMI down before starting the egg freezing?
Yes and no. Again, it can take 6 months for a woman to get her BMI to where she really wants it in a normal range. We'd like to have a BMI around 20, maybe to 25. And if you're up to close to 30, you want to lose weight. Absolutely. I think there's more risk to every IVF type procedure if you're very close to 25 or 30. And again, you have to individualize that in terms of how long it's going to take you to lose that weight or how close you are to that 20 BMI.
Melissa, you're very welcome. And the final questions we have here is, how many eggs do you need to freeze if you want to have 2 children? That goes back to what your age is. And as we know that as we advance in age, the quality of our eggs diminishes. So if you're young, then you don't need as many eggs. And then if you're older, so it really is an algorithm that is dependent on the female age.
So on behalf of all of us here at SCRC, we wanted to thank you all for attending tonight's patient education event. Great questions, great group of people. We had a lot of participants. We are very proud that you guys all came, and thank you for spending your evening with us. And we look forward, hopefully, to see you guys individually doing the consultations. If you guys need any assistance from us, let us know. You will be getting a follow-up email that will allow you to go ahead and make your consultation appointment. Thank you, everybody, and have a wonderful time. And thank you, Dr. Danzer and Dr. Akopian, for a great presentation.
Bye-bye. Have a good evening. Bye-bye.
Here to help
Bye,
you.
everybody.